Hi, everybody. Dietitian here, editor of the independent study courses for Ortho Academy. Today, I just got a chance to talk to Dr. Rachel Cutts, who's not only a PT, but a registered dietitian who's worked with high-level elite athletes at the professional level and everyone in between and below that and different than that. And we got a chance to talk to her about a wide range of topics related to nutrition and practice. And I'm hoping that you get something out of this and get a chance to kind of understand where nutrition has been, where it's maybe going, how to realistically, tangibly kind of incorporate this into practice. And I'm hoping that kind of kickstarts an interest more in the topic, which we hopefully can fill with that course. So hopefully you get something out of it, and I appreciate the time to take a look. Hello, everybody. Welcome back. My name is Dietitian. I'm the editor of the independent study courses for the Ortho Academy. And today I'm lucky enough to be joined by Dr. Rachel Cutts, who was an author for one of our courses, the nutrition course, specifically as it relates to injury recovery and then performance enhancement. So, Dr. Cutts, if you don't mind giving the audience a little brief overview, because it would take me about 30 minutes to do that. If you can give a little bit of a brief overview about kind of your background and what you're doing now, that'd be awesome.
Okay, no worries. Yes, thank you for having me and extending the invitation to write this draft. I got my master's degree in nutrition from Texas A&M. I actually had a really great mentor who encouraged me to dual major exercise nutrition. And then from there, I used that as a personal trainer and registered dietitian. And throughout PT school, I did that at fitness centers, a couple of gyms as well. And since I've been a PT, I kind of been incorporating them into my practice in orthopedic and sports settings.
Yeah, and your point being like when we talk about orthopedic and sports PT, obviously, at least in my practice, the main reason people are there is because they have pain or they're unable to do something they want to do. When you talk about an athlete, they're not performing at the highest level that they can potentially. And I think for me, at least, it seems so generic to say, yeah, nutrition would help, but having like tangible ideas of where to start and where to go, I don't know that we really do that very well. So, how did you get your background in nutrition and how did you feel comfortable being able to include nutrition as an intervention or a part of your treatment plan for athletes or non-athletes?
So at A&M, we have to do a year internship in different settings. So I got my introduction. Registered dietitians and exercise physiologists were kind of in the outpatient setting or cardiac rehab, bouncing ideas off of them. And it was a good in kind of doing a nutrition assessment as they enter the rehab process, and then kind of giving them referral to a registered dietitian as they kind of discharge out of like being in a subacute or acute setting. So I think it is important to kind of lay down the foundation of nutrition when someone starts their rehab program, and then kind of follow throughout. They discharge when you're not going to be seeing them consistently, giving them a referral, someone that they can kind of always go back to if they have questions on if something about their lifestyle changes or kind of have challenges of maintaining what you guys have implemented in the rehab process.
Yeah, and you come from a very unique background because you're kind of able to do both of those things, right? As a registered dietitian and as a PT, you're able to identify where's the movement dysfunction, where's the functional loss, but you're also able to kind of incorporate that nutritional evaluation and management. Most PTs don't really have that capacity, so where do you feel like the low hanging fruit would be aside from obviously, here's a plug, aside from reading this course and going through this course, where's the low hanging fruit for our PTs that can say, here's where I at least start when it comes to incorporating nutrition into my practice?
I think having it on the intake form, some like basic things, asking the question in more detail. So I know there's always a question about what medications, supplements you take, and then kind of diving, even if it's 5 minutes on the eval, that's when we have like the most patients, kind of just going over, do they have the basic things, multivitamin, a probiotic, vitamin D, and kind of starting from there. And then as you do your manual treatment throughout the plan of care, like those 15 minutes while you're having your hands on the patient, just kind of talking them through that in more detail. And if it's something that you can't answer, always a referral source in your back pocket. Like if they have more detailed questions, need more guidance, having a referral source.
Yeah, yeah, and you're bringing up a good point. Is in my head sometimes when I think about a course like nutrition, sometimes my takeaway is like, okay, now I know everything about nutrition, so I'm going to incorporate it. Technically, I can't do that in a lot of places, you know. So knowing my limitations, that's important. Knowing other people that can kind of pick up where I might leave off, and having a referral source, just like you would for a surgeon, just like you would for a psychiatrist. It's important to, I think, have a nutritionist in that kind of in that spectrum of that multidisciplinary team. Um, why do you think that's not happening more frequently?
Um, that is a good question. I know that some like organizations like in DC, MedStar, they have dietitians, but it's not really something that's like listed for the physical therapist to have like access to. They have to go out of their way to kind of find the registered dietitians who are under certain um, systems. So I think PT's prioritizing it and then making the people who kind of set the organizational structure, um, if they understand the importance of it from like the ground level and the requesting to have that information a little bit more easily available, I think that's kind of where it starts. Maybe they don't see a need yet, but once people like physical therapists or other healthcare providers, occupational therapists say, I really wish I had a clinician like who's able to consult quickly, like that would kind of lead them to make it a little bit more systematic process.
Yeah, yeah, yeah. Institutions are going to be a big part of it. Obviously, jurisdictions going to be a big part of it. And then, I mean, I'm practicing in DC also, so um, I know that not everyone has the same access to the same things that make ideal intervention planning logical or useful or feasible, you know. But when it does come to like a high level athlete, because sometimes we just forget that these individuals just perform at a high level, but they have a lot of opportunities to supplement and boost them to that high level. What are some ways that you keep people performing at this high level, that might be some tangible strategies for maybe a PT practicing in a high school setting? Um, what do you think are some general kind of ideas you can provide for people for that higher level process?
The high level process. So if you have access to athletes on an everyday basis, like if you see them in the morning, even if you the supplements having like a checklist, like did you take these things, especially if they're affordable in the morning with their breakfast, just kind of during the morning. Like I said, vitamin D, probiotics are my top three. Omega threes, especially with athletes. But just doing a checklist, even if the institution, even if it's like you can't provide supplements, just ensuring some compliance, some accountability to make sure that they've taken it. If they don't have access to a registered dietitian, you're the one that kind of is helping them guide their daily intake of supplements and nutritious food.
Yeah, yeah, and I always wonder, you know, when I'm teaching or when I'm practicing, especially, and this person's not getting better, I constantly think about like, what am I missing? So
Mm.
I think in some cases it's potentially this lifestyle variable of nutrition, and maybe that could be supplemented and boosted. Um, but I guess part of me wonders, you know, when do I know that nutrition might be more appropriate for this person compared to that person? Let's say you're taking care of people, and from an injury recovery perspective, you got two people with
Mm.
ankle sprains, right? Maybe a recent acute ankle sprain. What would make me think this person might benefit more from a specific discussion or implementation of nutritional strategies compared to this person? What do you think?
I think the question: do you have a dietary intake plan? If it consists of junk food, then you know that person probably needs a little bit more guys delayed healing. You know that it might have something to do with their nutritional intake. The body doesn't have what it needs to heal. Um, So I think those are two things. If it's delayed, if they're not responding to treatment like they should, even better if you have access to their blood lab, just seeing if there's any deficits, because slow down healing as well.
Hmm. And then, kind of similar, kind of going off of that, do you feel like there are certain populations that seem to benefit the most, whether it's like a, a certain patient population that, you know, they kind of lower the threshold for you to say, we're going to go ahead and try this approach?
Yeah, you have to go with the plant-based athletes. Sometimes it's hard to get their nutrients that they need, so always supplement like a B12. Um, and people in colder environments, making sure they supplement with vitamin D. But any patient that seems like they don't have a good dietary routine or haven't really focused on eating plant-based diet, whole grains and things like that, that's the ones I'm going to lock in and say you probably need some extra supplements. You know, if living a healthy, active lifestyle, I'm not as much concerned. But if they in conversation tell me something about like they might be deficient in something, then that would kind of have me kind of keen in on that and try to help with their supplement
Yeah.
intake.
Yeah. And I'll speak to my own bias, I guess, because when I think of, I mean, you work with professional athletes, and when I think of professional athletes, I think they're doing everything as prescribed by the book just to make sure that they're hitting all those performance markers. And I know that's not true, but in my head, I
Yeah,
like to believe that.
I do the standard.
Yeah.
Yeah.
But they have so much access to things, you know, but
Mm-hmm.
what's the compliance like? Because if I'm thinking about this person that's a high level athlete, um, my assumption is the compliance is higher, but not always. You know, is is there is there a difficult time getting people to buy in regardless of activity level?
I think that if you live a healthy lifestyle yourself, and you build rapport with the athlete, that it's easier for them to get the buy-in. Um, they see me taking my supplements in the morning, they see me working out, then they have a little bit more visual, like, oh, she's staying healthy. So versus someone who's trying to tell them to take these supplements and they don't actually do it.
Mm-hmm.
So I think the biggest thing is getting a rapport with the athlete, and then just small changes within their diet. So they can tell you they're eating junk food, they change that right away. But if you can give them a healthier alternative, I think that that's a big thing. So the compliance, like you said, it's not sometimes ideal, but as it goes on, you build rapport with the athletes. So I worked a lot in basketball with the new players, ones that were just drafted. Like, times their diet isn't the best, but as the season goes on, you can see their progress. And it's just about small changes and making sure that you meet them where they're at. They're human like anyone else. So, and
Yeah.
they think because they're healthy, that they don't have to kind of make those. But when you're in a high demand sport, it's a lot of wear and tear on your body. You just need extra supplements to kind of meet those. So that's about the body. And then also the blood lab values also help. If they're deficient in something, they're more likely to kind of take the supplement once you show them the numbers. These tend to be objective as well.
Yeah. I mean, we're all guilty of that, is thinking we know more and then not following through with the things we need to do. You know, that's
Mm-hmm.
PTs in general, I think, is
Yeah.
my knee hurts, I know what to do about it, but then you never actually do it. So
Sometimes everybody needs a hand holding for
yeah, I
sure.
think it helps to have someone guide the process for sure. Um,
Yes.
when you think about the process of kind of nutrition education, how has your practice changed, you know, from when you first graduated to now? You've gone through advanced post-professional training in orthopedics and manual therapy. How has that supplemented what you're doing with nutrition?
I think that it's been a big kind of effect. Anytime that there's acute injury, I'm thinking about what's the tissue that needs healing. We all know omega-3s help with inflammation, but like if it's a ligament, I want to make sure they're getting more collagen. If they have increased muscle source, having 2 a days of football, making sure they're getting tart dairy juice at the end of their workout, sleep, and help with muscle recovery. So it's just about at each stage, what can I do to kind of help them recover, accelerate their healing quickly. Um, just trying to make it combined and kind of cohesive plan with nutrition and rehab all in
Yeah.
one.
Yeah. And then, you know, at least from my perspective, again, I mean, it's kind of what I'm limited to in some ways, but I got a background in exercise science, so I have a background in nutrition and performance, but that didn't really translate very well because I didn't really utilize it, I guess, as I kind of have been practicing for the last 14 years. Um,
Mhm.
I guess I wonder, um, why are we not incorporating nutritional educational strategies more within PT, and why is this not more of a kind of standard of care at minimum to do what's within our scope?
Yeah, I definitely think that there should be a course on nutrition and rehab, actual graduate program. I think that our profession is just like any other. Like medical doctors didn't get a nutrition course. 2016, I remember I went to UNT Health Science Center, and I remember the deals were like, yeah, we're going to start taking a nutrition course, and I was like, oh, so giving them like, yeah. So I think that we're just trying to get up to speed, but I think um, once we once the profession kind of catches up with they'll start implementing that into the graduate program. But
Yeah.
we all know that nutrition impacts healing. So
Yeah, of course. Yeah, what we eat affects how we move and what we do with it. Um, and from a CAPTI perspective and our standards and our educational perspective, nutrition is supposed to be a part of the educational process. And
mhm.
I completely agree with you. Is we're kind of catching up to the evidence in a way. Is we're realizing the importance, and now we're incorporating into educational degrees. Where do you see nutrition being in 5, 10 years in regards to PT practice? And I recognize maybe there's some hurdles we have to face when it comes to jurisdiction and things like that. But when you think about like where we could or should be downstream, what do you think that is?
I think that having a dietitian who's a developed demand in PT clinics would be something that I see in the future. Just the initial consultation. I think that insurance is most cover a dietitian consultation. So I think that just incorporating that into the initial evaluation and getting people a jump start on the healing process with their dietary intake. I think that's where fast forward. I hope that the PT and the dietetic profession kind of go.
Yeah. Yeah, we start to see, I think, some of these more holistic, almost boutique type of clinics that have a multidisciplinary site and multiple
Mhm.
people at that site. And I think there's nothing really to complain about with that type of approach. Being able to just next door have the person that's the expert in the area be able to pop in or schedule that appointment with them. I think there's a lot of benefit to that, and maybe making that more mainstream, or even in university settings or things like that. That's a pretty
Yes,
important
certainly.
place to be, I think. Um,
Certainly, because in the professional setting, it's all and it's the continuum of care. So everyone gets their evaluation. Like athletic trainer would see the person in acute care, and then the physical therapist, and then the strength and coach. So it's just about kind of taking the person as far as you can. Then there's some blend, right? And then kind of the other person carrying the torch and getting the person back to play. Fishing kind of fills in where needed at each stage. So we can get that in the general practice. That would be fantastic. I know a lot of PT clinics are kind of combining with CrossFit gyms and things like that. So the strength coaches, PTs, I don't see why a registered dietitian um, doesn't fit into that equation.
yeah, I mean, I think that's a great idea. It's where we're limited, we need to have somebody fill the gap, you know. And if we can't do that ourselves within our practice, then having someone else to help us with that's important. What I guess my big question for you then is, what do you feel like is the hardest part for you knowing that your background is very eclectic, you can do a lot. What's the hardest part for you working at a different level than me, incorporating nutrition into practice for that physical therapy client?
I think in the outpatient setting, it's just about using those 15 minutes. Unfortunately, like that's how most outpatient clinics are, unless you're cash based. But using those 15 minutes to kind of get as much information, answer as many questions as I can with the patient. So just dual tasking and just kind of um, providing all that I can, physical therapy, nutrition, all in one. And I think that that's going to be the challenge with the PTs. We're already kind of backed up sometimes with paperwork and things like that, but those extra 5 minutes to kind of educate the the patient on even general nutrition. A lot of people, even though there's plenty of access, they still don't understand how to kind of implement into their lifestyle. So guiding them along the way.
Yeah. Yeah. For me, I mean, I didn't think about pain science when I graduated, and now it's a staple as part of everyday clinical practice, just about for every single person I talk to. I feel like sometimes I'm sitting down and talking to them about pain for 15, 30 minutes during the session. And if I'm talking to them about pain, why couldn't I also just kind of incorporate a little nutrition during that? Or how couldn't that be a nutrition discussion with that person that needs it, that I can provide it to? I think the trends that we have in our profession, they're moving towards being much more educationally driven for this person that needs holistic care. And I think that's important.
Exactly right.
And so I guess from your perspective, because I know my perspective and kind of spoke to that a little bit, but what would you think about as being like a parting shot? Like, what's the most important thing you would want PTs that are practicing in orthopedic, sports, high level, low level intensity activity, or athletics? What would you want that person to know when it comes to nutrition and PT practice?
I think educating the patient on alternatives to medications, I think that would be a step for us to kind of fill um, in cohesion with the physician, but finding alternative ways besides medication, anti-inflammatories to help manage pain. If someone says they're in a lot of pain, I think the big educating ourselves on things that can manage the pain that don't actually slow down the healing process. So in the monograph, I talk about making sure that the anti-inflammatories aren't in the acute stage, kind of slow down healing, just making sure that we know the best things to help manage pain and control or accelerate inflammation without hindering someone's progress. I think that would be the biggest thing for orthopedic physical therapists to take away from the monograph.
Yeah, and that was honestly one of my takeaways too from reading it and editing it and working through it with you is, I mean, I think there's a huge component that's related specifically to how do we get people from point A to point B, but also how do we also prevent them from going backwards, or how do we prevent them from slowing down that progression unnecessarily? And that's something that I've really valued and I appreciated when you wrote that up. That was really good.
Oh, thank you, thank you.
So
Yeah. And I mean, we could talk about the different phases, like doing the repair process to make sure they get collagen in, just like trying to figure out what supplements, like you can just mention to your patient, like, oh, this is a good point. This is going to start taking this supplement, getting extra as you go throughout this phase. So um, that's another thing.
yeah, yeah. Yeah, I appreciate that talk, and I appreciate the opportunity to be able to have this conversation with the patients that I'm going to be seeing next week because of the content that you put together. And I'm plugging very heavily the purchase of this course because of the resource that you put together. It's so extensive, but clinically useful. So I definitely appreciate it, and I definitely appreciate the time you spent putting this together because it's definitely important, and we definitely need more of it for sure. So I wanted to say thank you for the effort on it because we know it's a heavy lift. You know, specifically, it was a lot of work.
Yes, it was worth it though. Yes, again, thank you for asking me to. It was a pleasure. Help review kind of what I've learned throughout the years too, putting it
Yeah.
all in one piece. Thank you again.
Perfect. Perfect. So Dr. Cutts, thank you again, and I appreciate it. Hopefully everybody goes out and gets to learn from your expertise by getting this course, for sure.
Yes, thank you.
All right. Take care.